Hello, I'm Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have André Blackman here with us, founder and CEO of Onboard Health. Welcome, André.
Hi, Solomay. Thank you so much for inviting me here. Really excited to be a part of this amazing event and for us to have our amazing discussion as well.
Likewise. Yes, let's get started by how about sharing a little bit about what is Onboard Health?
Absolutely. So Onboard Health is a specialized executive search and talent advisory firm for companies who are building the future of health and recognize the importance and the need to build with an inclusion, a diversity, and an equity lens as they're building the future of health. And so, on one hand, we're operating as that kind of, executive search firm. And on the other hand, we're actually cultivating just an incredible diverse talent community of professionals who have backgrounds that are in engineering, data science, human-centered design, communications, just all sorts of amazing skill sets that are absolutely crucial in building an equitable future of health. So we love kind of building community, and at the same time, we absolutely love working alongside of companies that have this intention in mind.
Amazing. And what got you interested in this space?
Oh, wow. That is a great question. It's what I tell a lot of people is that it's a very non-traditional journey. But essentially, my entire career has been, at the intersection of public health, public and community health, traditional medicine and healthcare, just kind of, jumping into this space before, was really kind of looking at engineering as my kind of course track. But over the past 15 or so years, I've just really enjoyed coming across just incredible and dynamic pioneers and leaders and people who are dedicated to building the future of health. And so essentially, my career pathway took me, into public health and communications, always had this kind of lens on the future and technology and innovation, started writing about it way back in 2007. When blogging was hot and you're a rock star even if you had a blog. And so that's how I really start to build a platform around things like social media, digital strategy, technology, and how that was positively impacting and really transforming the field of public health and healthcare. And so over the past several years, really have stuck around in this space, building a couple different things, kind of creating Pulse and Signal, which was the name of the blog, and turned that into, a consultancy really around digital strategy. But it was really around spring of 2016. After just being in the space for a long time, I had the amazing opportunity to go back to my alma mater, the School of Public Health at the University of Maryland, go Terps, and give the commencement address to the outgoing class there. And that's when I really started seeing and thinking about the workforce. Particularly as we were seeing it back, especially around 2016, we were seeing the acronym SDOH starting to really creep up into a lot of conversations and things of that nature. And so essentially starting to see this kind of intersection around things like public health, prevention, SDOH, behavioral health, obviously, and how that was interacting with traditional healthcare and medicine. And so I started to think about the workforce and how it was going to need to be equipped differently and better for this kind of innovative landscape that we were seeing at that time, but also looking differently, right? And so this is, where Onboard Health really got started, is making sure that, as we start to see these companies who are tackling things like, mental health or chronic disease and food sustainability in the built environment, these are all things that are directly impacting everyone in our society, in all of our communities. And so it only made sense to me that we start to really look at how we build a more diverse and inclusive workforce to power this future of health that was starting to come around. And that's when Onboard Health really got started. And that's how I really, came into this space, from that lens, really being excited about the opportunity to prevent large groups of people from being sick and to live well. So that's how I got into the public health space. But also, with Onboard Health, that's the story of how I started thinking about things from a workforce perspective and really equipping the companies and also the talented professionals to see these incredible opportunities to build the world that we want to live in.
Yes, you certainly have been a pioneer early on all things intersecting health equity, social determinants, digital health, and really excited for you to share more about that. Speaking of which, you've written quite a bit about how organizations can and who already are building equitable health innovation through powerful, inclusive teams, as well as cultures of impact. What exactly is that and what does it look like?
Yeah, I mean, that's a great question. I think, even before, you get into the strategic and the tactics piece, it's really kind of taking a step back and thinking about the landscape that we're in right now, where we're starting to really get a sense of how we need to look at things from that kind of population health perspective. Things aren't necessarily siloed anymore between, public health and traditional medicine, right? A couple years ago, we started seeing hospitals start to invest into local neighborhoods, right? As we start talking about, value-based care and really kind of taking care of the community around us, just kind of taking a step back and looking at that lens is where we're all at right now, right? And so in order to do this well and sustainably, we do have to look at things from an inclusive and an equity lens. And so some of the things that have really just kind of made a huge impact for the companies that we've been working with and talking to about certain things is right off the bat. If you're looking at building an incredible and inclusive team, taking a look at your recruiting process, right? Oftentimes, especially as you and I both have seen in the startup space, you really just want to kind of get that quick traction. You get a team together and get these kind of early wins and things of that nature, right? But really being able to be mindful and intentional about how your process on attracting talent, pulling them in, engaging them, and also retaining talent is absolutely critical. And so I definitely challenge organizations to look at your process. What are the ways in which you can maybe take an audit to ensure that there's a lens on inclusion and equity, right? Just taking a look at how you're sourcing candidates. This is something that I think about all the time, right? Especially now, especially in the bigger and broader kind of tech community as well, looking at community building, right? And really looking at your employer brand so that, what you're talking about is actually matching up with how people view what you're doing and your organization. So everything from marketing materials, right? Taking a look at making sure that the people that are represented across your employer brand and in materials and things of that nature, who is representing your companies on stage at events, right? These are all the different things that make people think, oh, okay, I didn't know that this company was doing that. Let's take a deeper look. Oh, okay, there's a reflection of the population in which they are actively serving, right? You think about companies that are tackling things like mental health, right? This is why we're here, why we're talking about these kind of things around behavioral health, specifically in oftentimes underrepresented and marginalized communities. Things like mental health are absolutely top of mind, right? And so if you're even close to innovating around things around mental health and things of that nature, your team needs to look like this, right? The materials that you send out need to reflect the communities that you want to serve. It kind of sounds like it's very fundamental, but you'd be surprised at how oftentimes that's something that needs to take another look at. So apart from that, looking at how you source candidates, oftentimes, we kind of look at our own kind of field and circle of influence, and that oftentimes, creates an inherent bias around, the kind of pipeline that we're looking at, right? And so oftentimes, especially, several years back when we heard about diversity and inclusion in hiring, it was talked about, the talent pipeline isn't there, right? So I'm definitely here to say the pipeline is out there. And it's really all about being intentional and thinking about other ways in which to source candidates. What kind of communities are already established that you can build relationships and partnerships with in order to kind of build that trust, right? And so essentially, looking at your leadership at the same time, this is once again, we're in health and healthcare, right? So trust is absolutely critical to how you're building your organization, but at the same time, how your services and products get created is oftentimes, up to the leadership in your organization. Your leadership absolutely has oftentimes the authority to drive the services and products that you're building, right? And so once again, when you have more diverse leadership and you're looking at the leadership that you have in your organization, those are the kind of things that matter when it comes to building products and services that port directly into who you're trying to reach. And then finally, if you're, creating a culture, of value for your team, for your organization, how do you celebrate diversity? How do you celebrate the contributions of individuals, right? These are all different things that matter for people inside of your organization to feel like they're part of the mission, to feel like they're part of the vision. And that's really where, having that lens of equity, making sure that people have voices, and also making sure that, people are able to build alongside of you. Those are absolutely critical aspects of the culture that you want to build as well.
What really amazing and important considerations for the companies and organizations in our audience to really take to heart. Could you talk a little bit more about why it is especially important in today's day and age that healthcare organizations consider diverse leadership?
Absolutely. I mean, it's once again going back to that issue around, where we're at right now, right? Really looking at this convergence of things of the nature around social determinants of health, public health. It's not the same kind of situation where it's just medicine or just healthcare or just public health anymore, but we're starting to see everything starting to converge, right? And so if we're looking at food sustainability and access to healthier foods, transportation, how that has come into our landscape when companies like Lyft and Uber are starting to roll out opportunities in order for patients to get to their appointments, or how prescriptions are being delivered, right? It's a whole different lens that we're at right now. And in order for things of that nature to really kind of move forward, once again, the leadership has to reflect the populations and the concerns and the issues that our communities are facing, right? And so having that kind of lens, just kind of lends itself once again to having leadership that reflects the communities that you're building products and services for. If we're looking at things from a behavioral health lens, once again, it only makes sense that your team's leadership make sure that those kind of answers from their own lives and things of that nature, and the diverse perspectives that they have really kind of port into those services. Once again, just a couple of years ago, we wouldn't think that eating disorders would be an area in which we're seeing innovation happening. But we see amazing companies like Equip starting to take that on and actually have traction around it, right? And so that wouldn't happen if it wasn't for leaders and people to stand up saying, hey, this is part of my lived experience. I know this is an issue. Let's actually build a solution around it. Similar to Kevin Dedner over at Hurdle, right? Really kind of documenting and being honest and transparent around his own kind of battles with mental health, especially as a Black man in America, right? And so these are all the different things that I feel are absolutely critical, as we start looking, at the leadership that we have as the pioneers, who are leading the charge in these kind of areas, because they're actually creating solutions for issues that oftentimes have not been addressed before, And so this is where I think it's really important for especially leadership and organizations to make sure that that you're doing the kind of historical, reading, especially when it comes to, our industry around healthcare. There's a ton of examples of how, things like, racism, have been, absolutely embedded into our ecosystem, right? A lot of people kind of look at, the Tuskegee experiment when we're looking at now at vaccines and things of that nature, but it's a very real issue when it comes to trust, particularly in Black and Brown communities, right? And so if we zero in on that, and reflect that back into our teams and our leadership, those are the kind of aspects that can help us actually build what we need to build.
André, can you tell our audience what you've seen in terms of what leaders struggle with as they attempt to engage their organization in our current climate with inequities and racial injustice?
Absolutely, Solomon. I mean, and let's be honest, right? This past year has been really hard for everybody, right? And I think like the lines between work and life and taking care of ourselves, right? Have been blurred all over the place, especially as they were before. But now, after the pandemic, after seeing racial injustice from, the George Floyd murder and the subsequent trial and things of that nature. It's really kind of changed, I think, the conversation around, the world of work and how we really can pay attention to, looking at the health and wellness of our team members, and really kind of taking a hard look at how that impacts, the culture that we're all building here too. So, one of the struggles obviously, has been how do you even start having conversations with your team, right? And this is something that oftentimes leaders, especially, if we're looking at, things related to, racial injustice, if, how do you start, having those conversations that are really tough? I think the first thing that I'll say is that as leaders, even if you don't have all the answers, and this is something that I struggle with all the time, just the mere fact that you're bringing this up, and bringing up that this is actually happening in our world, in our lives, in our communities, really kind of sets the tone for the vulnerability that's needed to start having real conversations. And so taking that first step to just know that this is a tough conversation, but at the same time, it's often necessary, especially if we're looking at how we're building the future of health, right? I mean, there's an incredible documentary called The Interrupters by that really kind of looked at gun violence and violence in Chicago from a public health lens, right? And looking at how communities respond to, right, for or in these kind of situations, right? And so this is actually like directly tied to things from a behavioral health lens, right? From a mental health lens, right? These are all things that actually matter to the work that we're doing. So if we're not, having these kind of discussions, that we're doing our team a disservice, we're doing ourselves a disservice, but we're also doing a disservice to the people that we want to impact with our work, with our products and services. And so at the very beginning of it, knowing that you're going to need to have these conversations, I think is super critical. And then the next kind of piece of advice I would definitely give is get some help. If you need to bring in outside help to really kind of create a foundation for these kind of discussions. Obviously, there are a number of different organizations that help with facilitation of these kind of conversations with your staff, with your senior leadership, things of that nature. It's so critical to make sure that you have these kind of things in place in order to make, once again, as we talked about, your organization feel that they're a part of something that is not completely separate from daily life, right? And I think that, once again, we're in the business of, looking at how life impacts our health and wellness and in our livelihoods. So I would definitely think that, some of the advice I would give is, just getting comfortable with being uncomfortable. This is something, that you might hear all the time, in this kind of current climate, but, is absolutely critical. This is something that Natalie Burke, who's the CEO of Common Health Action, talks about all the time. She lives it, she breathes it, she talks about it to a number of organizations. But these are things when it comes to looking at health equity and things of that nature are absolutely critical to say, you know what? I know that this is not in my complete purview to be an expert on per se, but I know that I need to partner with people that do. And so I think that's a big piece that I would say is a struggle that I see right now. And oftentimes, some of the advice is to get help if you can.
Really great advice. And I'm sure a lot of people in our audience are asking those questions. So super helpful. And final question for the day is, what is your hope for the future of equitable healthcare leadership?
Yeah, that's a great question. I mean, there's a lot in there, right? especially what we talked about before, with our current kind of climate and, a lot of things in flux with the pandemic and everything else. I think, my hope for, the future of equitable leadership is that it's natural, right? Looking at what we're doing at Onboard Health, like it's really about, visibility and representation, making sure that, we realize that the leaders that reflect, the diversity of our communities are out there, that they're ready to build alongside of, amazing organizations that are building the future of health and making it very much a relationship driven effort, to build that kind of leadership. So that's what I'm really hard at work on, is making sure that it's not something that's kind of compartmentalized, right? That we have to do diversity recruiting and things of that nature, but it actually lends itself to the natural element of the work that we're doing. And I think like that's going to be a big part of the next couple of years that we have right now, especially as we start seeing more of the fallout, from 2020, especially around our workforce, especially in this work here around behavioral health and looking at the wellness of our organization, from a staffing perspective and how we meet those needs, in a valuable way. And so I would definitely feel like the hope is to make things a lot more natural. Once again, organizations, really taking an understanding of how to build more equitable organizations, looking at the process on how they build their teams. And once again, really kind of making sure that we're empowering opportunities for more equitable leadership, in this space as well. And this really comes from having those kind of co-created, conversations with the people that we're actually building for. I think this is something that's absolutely critical to the longevity of the companies that we're all talking about and that we're all building with right now, is that it's no longer a top-down approach, right? Leadership is going to start looking different in very clear ways. And so the ability to actually tap into the audience and the communities that you're building things for, and allowing them to actually speak back to you on their needs, I think is going to be an absolutely critical aspect of leadership going forward, in an equitable way.
Really great. Thank you so much, as always, Andre. I wish we had a little more time, but alas, we have to wrap up. Thank you again for your time and insights.
Thank you, Solomon.